It is 8:11 this morning in your Health Watch. Today is National Nurses Day. And this year it's coming as many healthcare systems are facing nursing shortages. Stop me if you've heard that before, because we have talked about it a lot. The problem is still here. What are we going to do about it? Here, joining me now is Lisa O'Connor, the nursing school dean at Quinnipiac University. Lisa, good morning. How are you today?
Good morning. Thanks for having me.
Glad to have you here. And I know complex problems probably require complex solutions. Let's start first and foremost by talking about what you guys are doing down there at Quinnipiac, the partnerships you've made to try to resolve this nursing shortage.
Sure. Thank you. Yes. So at Quinnipiac, we've taken what we've already have strong relationships with our clinical partners, particularly the Yale New Haven Health System and the Hartford Healthcare System. And we're deepening those partnerships to make them a bit more strategic. We know that the nursing workforce shortage really, Tim, is due to capacities in nursing schools being capped because we have clinical site limitations and we also have a national nursing educator workforce shortage. So together with those two healthcare systems, we're tackling that.
Does that, can I infer then there's not necessarily a shortage of people interested in getting into nursing? It's just a problem getting them spaces and getting them training?
That is correct. All of us here in nursing, all of the nursing schools, we have really robust application pool and very highly qualified candidates. It's that we can't take them all into our programs because of the educator shortage and needing some more support in the clinical field.
Well, that's actually, I would think, good news, because a lot of the times we've approached this nursing shortage problem from the perspective of the current nurses, many of whom told me personally they're just getting burned out, which is really saying something, because I'm sure you will agree that a lot of nurses consider what they do a calling, not just a job. Why don't you talk about, is there anything also being done on the end of the nurses who are out there that you know of? Obviously, this is not something you're necessarily doing at Quinnipiac, but just to try to be able to replenish that drive for the nurses who are already there?
Sure. All of our colleagues in the actual healthcare delivery systems, they have a variety of support services set up for their staff to make sure that they're well supported, both physical health, mental health. There's been a lot of development in that area, certainly since the pandemic. And I know they're working hard for all of their retention strategies. But I think also part of that retention strategy is seeing the freshness and the newness of the new graduate nurses coming on board and how they can actually impact bringing them on board and transitioning them to their professional practice.
How has the pandemic changed how you're helping those nurses prepare, if at all?
Sure. Well, at Quinnipiac, what we've really done is develop our simulation program to the best that it can be. We have top-of-the-line equipment. We have faculty and staff who are specialty certified in those areas. And simulation has really been an important friend and foundation for our nursing education, allowing our students to practice and play and learn in a lab setting, in a safe space, many of the things that they'll see then when they get to the live patient experience.
Okay, well, Lisa, thank you so much. Personally, pleasantly surprised to find out there's a lot of people still wanting to get into nursing. That portends at least a bright future is on the horizon, even if there's a problem now. Lisa O'Connor, thank you so much for taking the time to join us this morning.